Hello everything, today's video I will introduce to you arterial blood gas analysis. Arterial puncture. Puncture of peripheral artery to obtain an arterial blood sample for direct measurements of pH, PaCO2, PaO2, and for arterial blood gas, used to check how the efficiency the lungs are able to move oxygen into the blood and remove carbon dioxide from the blood, as well as the acidity and alkalinity pH of blood. Well, what are the possible indications for arterial blood gas sampling? Number 1. To evaluate the adequacy of the patient ventilation, oxygenation, and or acid-base status. Number 2. To assess the needs for therapeutic interventions and or diagnostic evaluations. For number 3. Monitor the severity of progressions of the documented disease process. What's possible contraindications for arterial blood gas analysis? Number 1. Negative modified Allen's test, decreased or absent collateral circulations. Number 2. Previous surgery in the artery or have fistula or patient with under dialysis. Number 3. Patient with anticoagulant or with known as coagulopathy. Number 4. Skin infections or damage of the skin. Number 5. Severe atherosclerosis. Number 6. Serious injury to the extremity. Number 7. Fibrinolytic therapy. Okay guys, I already introduced the indication and contraindication of arterial blood gas analysis. Let's go to hazards and complications. For hazards and complications of arterial blood gas analysis, number 1. Arteriospasm. Number 2. Air-clotted emboli. Number 3. Anaphylaxis from local anesthetics. Number 4. Patient or sampler contaminations or have infections. Number 5. Hematoma. Number 6. Hemorrhage. Number 7. Trauma to the vessel. Number 8. Arterial occlusion. Number 9. Vasovagal response. What are the procedures for arterial blood gas analysis? Let's go. Number 1. Check the patient chart. Number 2. Confirm steady state conditions. Number 3. Obtain and assemble the equipment and supplies. Number 4. Perform hand washing. Number 5. Explain the procedure to the patient. Number 6. Position the patient. Number 7. Perform modified Allen's test. Number 8. Thoroughly cleanse the site with an antiseptic. Number 9. Heparinize the syringe and expel excess. Number 10. Palpate and secure the artery with one hand. Number 11. Slowly insert the needle bevel up through skin at 45 degrees angle until blood pulsates into the syringe. Number 12. Allow to 4 ml of blood fill the syringe. Number 13. Apply firm pressure to the puncture site with sterile gauze until the bleeding stops. Number 14. Expel air bubbles from the samples and cap or plug the syringe. Number 15. Mix the sample by rolling and inverting the syringe. Number 16. Place the sample in transport container with ice slush. Number 17. Properly dispose of waste materials and sharps. Number 18. Document the procedure and the patient status in the chart and on the specimen level. Number 19. Check the site after 20 minutes. Okay, let's go to modified Allen's test. A test that used before any rate puncture to assess the adequacy of collateral circulations of the ulnar artery. Test is positive, indicating adequate collateral circulations if the palm, finger, and thumb flush pink within 3 seconds after pressure on the ulnar artery is released. Okay, let's go to performing modified Allen's test. Number 1. Ask the patient to clench his or her hand into a tight fist position. Number 2. Apply a pressure to the radial and ulnar arteries. Number 3. Ask the patient to open his or her hand. And number 4. Remove the pressure on the ulnar artery. And number 5, observe if the palm finger and thumb flush pink within lesser than 10 seconds. Okay, let's go to radial artery puncture sites. Number 1, locate if the wrist of the radial side thumb side close to the skin. Number 2, referred site for sampling. Number 3, near the surface and relatively easy to palpate and stabilize. Number 4, effective collateral circulation exists in the ulnar artery. Number 4, not near any large veins. Number 5, procedure is relatively pain-free. And number 6, insertion of the needles is at a 45 degrees angle. Procedure of ABG. Gather the necessary following equipment: a blue 23G needle, 2 ml syringe with heparin, a cup for the syringe, a plastic bung, local anesthetic plus needle and syringe for giving, alcohol gel, gauze, glove, a sharp bin. Usually the syringe, needles, cup, and bung are provided in one pack. Okay guys, let's watch my video performing arterial blood gas analysis. Hi everything! Yung gagawin po natin ngayon ay ABG analysis. ABG analysis po yung magtitignan po natin yung oxygen level ng patient kung normal o abnormal. Maganda nga po Ma'am Noemi. Ikaw po ba si Ma'am Noemi?
Yes po.
Ma'am Noemi, kukuhanan po namin ano po. Para tignan po namin yung oxygen level ng yung dugo para makita po namin kung normal or abnormal yung dugo po niyo.
Sige po.
May nagda-dialysis po ba kayo or other medication?
Hindi po.
Okay po ma'am, thank you. Kukuhanan po kami ng dugo at titignan po namin yung circulation ng dugo niyo kung normal or abnormal. At may prefer po namin yung modified Allen's test para makita namin kung collateral yung blood circulation para makuha nyo kayo ng ABG.
Sige po.
Okay. Nose open. 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 Yung nose open. Wait po ma'am. Close mo po. Open. Ma'am, check na pa yung pulse mo. Please subscribe to my official videos here about this at youtube.com.
Hi! Mag-iingat ka palagi ha. Lalo na ngayon, uso yung COVID-19. Lagi kang magmas at alcohol. Pinasa ko sa iyo to kasi importante ka sa buhay ko. Mag-iingat ka, pati yung family mo, ingatan mo. Huwag kang maglalabas ng bahay para safe kayo palagi. Ingat, God bless. Ipasa mo din to sa mga taong importante sa'yo.